So one of the things that I try to help people conceptualize is the idea about sequencing. We think first, and then we use the AI technology or LLM to help us in that process. Because once we reverse that and we stop being the originator of the thought and we substitute and allow the AI to displace us, that's when AI could theoretically replace us.
Hello, and welcome to Season 3 of Beyond the Couch, AI in Psychology. I'm your host, Dr. Ernest Wayde. So as always, before we get started, I always want to take a moment to thank the organizations that make this podcast possible. This episode is sponsored by the American Board of Professional Psychology, the National Register of Health Service Psychologists, and my consulting firm, Wayde AI. Their support helps us create thoughtful, psychology-focused conversations about how AI is shaping our field. My guest today is Dr. John Gavazzi, a board-certified clinical psychologist in independent practice and a long-time educator in ethics, mental health law, and clinical decision-making. He spent more than 25 years helping psychologists think through difficult professional questions, including serving as president of the Pennsylvania Psychological Association and chair of its ethics committee. John, welcome to the show.
Hey, thanks for having me.
Really glad to have you here. And before we get started, I always like to start by asking, can you tell us a little bit about yourself, your work, and the journey that led you to AI, including some of the experiences that might have shaped your perspective?
Okay, well, first of all, I'm old, so I'm going to try to contain myself. So I'm in my 60s, and I've been a psychologist since 1990. So I've been doing this for over 35 years. So just as kind of a general idea is my master's degree is in psychology, but it's a certain brand of psychology. It's an existential phenomenological psychology, which is basically a philosophical basis to psychology. And I typically bring that framework to everything that I do. Now, as I've said, I've been a licensed psychologist for quite some time, and I think that my background in philosophy kind of led me to ethics. So I've done a whole variety of ethics education over the years. And as AI started to emerge, I immediately saw a whole variety of ethical issues that were going to come up because of just the nature of the work that we do and what some thought leaders at the time were proposing. So I got an early start on it, but I really wanted to focus on how any type of AI can help us as psychologists engage in high quality care, because ultimately that's our goal. So if we do anything at all in the practice of psychology, we need to think about it in terms of how do we get people to engage with and to perform high quality care.
Yeah, absolutely. I love that. I mean, that's really great grounding for us as psychologists. Now, you've described AI as both transformative wave of psychology, but you've also argued that it will not replace human psychologists. What do people misunderstand when they equate increasingly convincing AI performance with that ability to practice psychology?
Well, I think one of the things that we need to keep in mind all the time is that we, as the psychologist, we're ultimately in charge. We're ultimately accountable for what we do, and by extension, what artificial intelligence or large language models, LLMs, do for us. So one of the things that I try to help people conceptualize is the idea about sequencing, is that we think first, and then we use the AI technology or LLM to help us in that process. Because once we would reverse that and we stop being the originator of the thought and we substitute and allow the AI to displace us, that's when AI could, again, theoretically replace us because we're offloading so much of the work that we do to the technology. So again, we need to be in charge and be held accountable. And I think one of the pieces that got a lot of psychologists scared, and I still have these dialogues online because they still believe that chatbots, or once we reach, and again, I don't know how technical to get into here, once we reach artificial general intelligence, whenever that day comes, it's always 3 years or 5 years down the road, that would be the scary time for everybody, because artificial general intelligence is when an AI technology actually equals what we as human beings can do. So we're in the pre-AGI period. So we can call this weak AI or naive AI. Again, I'm not wedded to any specific words and how to describe this, but the idea is that the way the technology is now, it cannot replace us for a variety of reasons. One, there's no way that an AI technology can actually do exactly what we do. AI is very good at pattern recognition. But when you think about general intelligence and you think about what we do in terms of psychotherapy or assessment, it's more than just pattern recognition. And so, what we really need to be thinking about again is how AI can help us with pattern recognition, what the strengths of those tools are, and what can we pull into our practice. However, understanding culture, theory of mind, being able to reflect back non-verbally to our patients, facial expression, maintaining eye contact. These are all things that AI technologies cannot do currently. And so that would not allow them allow the technologies to replace us because they just don't have the equipment that we do in terms of, again, social bonding, in terms of
Yeah.
nonverbal cues. So
Yeah. I love that, and I think that those are really important, points that you pointed out. We also know from the research, though, from the client's point of view, that a lot of clients are using AI mental health services, even things like ChatGPT that isn't even, fit for purpose specifically for this sort of thing. So from their perspective, what do you think that they're getting from these AI, chatbots? Because we know AI can imitate really well, right? What do you think they're getting from AI that encourages them or that lets them go back time and time again for these services rather than going with human?
well, I think what we know from the literature, and there have been some writings about this, not a lot, but trying to figure out what is it that people are using these GPTs for. What's happening. And so again, some of the reasons that they turn to them is I don't want to say a crisis, but like an urgent matter, practicing, like if they have social anxiety, that they can use them for practice, some self-reflection. So they're using the LLMs for very kind of specific purposes, not as a replacement for therapy, but really kind of as an adjunct to therapy. And what we know about even some of these, they call them AI friends, that we have some research on that as well, is that these AIs are available for people 24 hours a day, 7 days a week, and they're a little sycophantic. So, but what happens is after several weeks, most people find that then off putting because, again, that's not really what a relationship's about because a relationship isn't all about one person. It's about, what is going on in the relationship. So, it makes the relationship too easy. They kind of get bored with it and then they move on. They stop using them. So again, I don't know all of the research with the chatbots, but I think people use them up to a point and then, they really can't use them for anything for long-term therapy.
Yeah, so this is really interesting because I think we've also talked a little bit about how the advent of this new technology provides some opportunities, right? And so I'm really focused on this season, really thinking through what is it that we need to preserve, what is it that we need to redesign, and how can we guide the AI development. So when we look at it from the perspective of what do we need to preserve, right? What part of the work we do, the psychological practice, must remain firmly under that human professional control.
Right. Well, again, I kind of already let the cat out of the bag for one of them is that right. Digital empathy is not human bonding. So, the way that we are with other people in terms of the relationship, we bring hopefully our professional self as well as our authentic self. So, what we're doing is we're trying to have an actual human connection. And that's, again, something that an AI can't do. So, we need to preserve that. I mentioned this before, the accountability aspect that if we as human beings make an error, then we're going to be held accountable for it. Whereas with these chatbots, et cetera, they aren't going to be held accountable because again, who do you hold accountable? Is it the software developer? Is it the programmer? Is it the company? I mean, there's no accountability structure. So I don't think, and again, a couple of states have already outlawed, banned chatbots for psychotherapy, which is a good thing
Yeah.
because that's the issue is that there's no one to hold accountable. And if these companies go into multiple states and they find an error in the code, then what's going to happen? They're going to have to withdraw that from potentially thousands of people in order to fix the code and then to try to set it out again. So again, it gets very complicated very quickly. So I don't think any state will ever license a mental health chatbot. So again, that's what we have to preserve, like the human connection, the accountability, which also includes our ethics. And again, that's why we want to engage in high quality care. And then the last thing is our judgment, because again, we've had years and years and years of training, we've had years and years of experience, and that's what we're doing is we're bringing that with us into the psychotherapy session.
Yeah, I love that the years and years of experience and training that we bring into the session. I'm also thinking about what you said in terms of no state is ever going to license an AI chatbot because we talk about accountability. Who do you hold accountable if it goes wrong, right? On the other hand, we also know that there's been some research that shows, from the Therabot study that people sort of feel like they're in a therapeutic relationship. And so I was having a discussion with a colleague the other day, and we are talking about how do you distinguish between simulated empathy from an AI chatbot, perceived empathy, and the empathy within a human therapeutic relationship? Because a lot of clients may not know the difference, right? As clinicians, we have a good handle of it, but how do clients tell the difference? And does it really matter to them if they're feeling better?
Well, again, I'm gonna hazard a guess and say, yes, it really does matter. Because again, I think most people in order to have that social emotional bonding, that they need feedback. And again, whether it's verbal feedback or nonverbal feedback, because again, just think about yourself when you're doing therapy. You most people try to have some kind of neutral stance to it. You don't want to, you're not cracking jokes. You have kind of a
Yeah.
but if somebody tells you something really profound, like, "Hey, my aunt that I was really close to died," and we don't have like some kind of like moving forward and, kind of a look on our faces that we're trying to connect with and to say, "Yeah, that sounds really bad." I mean, it's more than just the verbal communication. It's more than just like the linguistic that the LLM will produce. It's actually the nonverbals that go along with that. And I think that's a very important part of that connection and showing care, because ultimately that's what people want is that people care about them and they have some kind of emotional investment in the process.
Yeah, I think that's a really great point in terms of the emotional investment in the process. AI can't do that, right? It doesn't have emotions to invest in it. I'm also thinking about clinicians using AI. There's more research that shows that more and more clinicians are beginning to use AI in their work, providing therapeutic services. What professional capabilities are psychologists at risk of weakening if AI begins handling too much of that work that they're allocating to it? Do you think?
Well, I think just kind of in general terms, and I mentioned this earlier, and I'm going to kind of emphasize it now. It's this idea about cognitive offloading. So the idea is that I don't have to think anymore. My job. I mean, think about your job. Everybody out there who's listening to this, think about your job. It is cognitively taxing and it's emotionally taxing, right? At least that's what I feel sometimes at the end of the day. Like, oh, geez, it's been a rough day. So it can be both, but it's very seductive then to offload some of this cognitive load that we're dealing with. So I think that will be a problem in the long run. So again, it's the sequencing part. So if you are a psychologist and you're writing a report, we'll use that as the first example. I have a couple other use
Right.
cases that we can talk about. So it's great that if you had like an AI that you put all the testing results in, IQ, achievement tests, personality tests, and then you put it into the AI again with de-identified. So,
Yeah.
you never put identified information into an LLM. So it's all de-identified. And then the LLM produces this wonderful report. Okay. And then you look at it and you say, wow, that's great. Okay. And I'm going to cut and paste it. Okay. We don't want to do that. See, that's when so we're we're not doing the thinking first. So it would be great if that what psychologists do is that they review everything and they write out some formulation first, then plug it into the LLM, and then hopefully the LLM will give us some patterns that we didn't recognize before, because that's what they're good at, pattern recognition. And so maybe even giving us a bit of a brief write up. But the idea is we want to do our own thinking first, because otherwise we're going to start slipping in terms of our competence. We're going to become over reliant on AI, and we won't do as much thinking as we're supposed to, or we need to as professionals. Because again, that's what we do, that iterative process about doing the work over and over again. And that's how we hone our skills.
Mhm.
So one of the
Yeah.
things that we also know is automation bias. And this has been documented even before AI came onto the scene, but we'll talk about it now. There was a study by, if I say the name right, Quasi, Quazi. It's on my blog, which we'll talk about in the future here, later on in the podcast. But the idea is that they took physicians and they trained them specifically to not take the AI's output at face value. So they went through 20 hours of training, then they seeded in some intentional errors to see if the physicians would catch it. And even after this 20-hour literacy program, they didn't catch it. So again, there's no reason to believe psychologists are going to be any better at this than physicians. Will be equally as bad as that with automation bias. So again, that's what we don't want to do, because then we're going to end up making mistakes. And again, that decreases then the quality of care that we're giving, or that's decreasing the quality of forensic reports that we're doing. It's decreasing the ability for us to provide great educational evaluations.
Yeah, I love that, and that's a great study. I've read that study, and one of the things that I found was really interesting was that the physicians even discounted their own recommendations and their own responses in favor of the AI, right? Because I think we get lulled into that sense of AI can be very fluent, and so we sometimes equate fluency with accuracy. Talk a little bit about from the clinical perspective. What do clinicians need to know about when they're using AI? What they should be looking out for in terms of that accuracy versus the fluency.
Yeah, well, you're using the terminology. That's exactly what I was going to say, because that's what most of the literature is moving towards, this concept of fluency, right? So just because an AI produces something that sounds really good, and again, side note, that's what these technologies were trained on. They were trained on thousands and thousands and thousands of texts, so they know language really well. So when it comes to what they produce, it sounds really great. So what
Mhm.
people need to be thinking about is, and again, this is why you have to write down your own things first, your own ideas first, is then to say, what might be missing from that? What might the AI be omitting? And it could be, and I'm going to give you an example of this, but it could be actual, fact-based knowledge that we psychologists should know. Another thing that it could be is like, what is it omitting? What is it intentionally not not putting out there? Is there any kind of race bias? Is there any kind of other cultural bias? Because again, these technologies have been trained on majority culture. So again, these are just some real, from my perspective, real obvious points that I think sometimes that psychologists might miss that.
Yeah, I think that's a really great point in terms of what do we know that the AI doesn't know and might be leaving out of the context, right? Because context is also really important to whatever it is that we're doing. Now we know AI is here and it's being implemented in a lot of healthcare systems, and so some psychologists don't have a choice as to whether they get to use it in their practice, sometimes in their workflow. What do we need to know as psychologists in terms of how do we redesign our workflow? And I love your concept of doing the work first before taking it to the AI. What else do we need to know as we're redesigning the way in which we work with AI?
Well, again, I think believing that it's a tool and that we're in control of the tool. So we need to figure out what I call use cases. And again, this is what, other technologists call it. So in psychology, like what are the use cases? So we've mentioned a couple already. So we've said about helping to write assessments. Okay, so that could be a use case that we use it for. But that again, that's what we need to do is we need to put our ideas down first, then allow the AI to help us in that process. I don't know how many people out there need to do treatment planning, but that's another use case that we can use AI for. Our own self-reflection and personal growth. So again, let's say that you've been trained in CBTI. This is the example I give all the time, but you haven't seen anybody with insomnia for about 9 months or a year, and you want like a real quick refresher course. You can use one of the AIs out there to gather the information, high quality research based information, and then produce some training material. Again, this isn't saying you're going to be certified in anything, but it's used as a reminder or a refresher. So again, if you've never done custody evaluations before and you're asking an AI to pull information so that you can become a custody evaluator, that's not what I'm saying. I'm saying that you're already trained, you want a refresher. So again, using it for refreshers on both content, and you can actually use it as a tool for self-reflection if you run into problems with patients. So your own countertransference, you can kind of get some ideas bouncing back and forth with an AI about what is it that's going on with me to understand what I'm doing with my patients, like whether I'm getting angry, whether I'm getting frustrated. And then once you have some thoughts down about that, now I'm kind of saying the opposite of this, but then take it to a colleague and say, "Hey, look, I'm really kind of struggling with, uh, some anger and some emotional reactions." So, but now you have some ideas. So the AI may help you frame at least what some of these issues are, so that you can then have a really good consultation with someone.
John, I love that because it really highlights to me part of how AI can be helpful and useful. Of course, always validating the responses and all of these things and bringing the context that's always helpful. But then it makes me think about clients, right? If clients are using it in a very similar way as you've described as how we might use it as clinicians. So really from that perspective, what do we as therapists and psychologists need to think about differently, or how do we need to approach things differently, knowing that our clients are using it in a very similar way as what you've described it, and sometimes coming into the therapeutic session with notes from ChatGPT or suggestions from ChatGPT. How do we need to approach this differently to adapt to that new reality?
Well, I think first of all, asking our patients, because I'm kind of chuckling because the first time this happened, it then dawned on me that I should be asking my patients about this. So about a year and a half or 2 years ago, one of my younger patients said, "Yeah, between sessions, I was asking ChatGPT, and this is what came up." So again, I think you need to incorporate your own theoretical orientation into how you approach this. My approach is more in terms of curiosity, is trying to understand again, like I had said earlier, what prompted them to go to the LLM. How was it beneficial? How was it not beneficial? And again, you don't want to, like I said about the nonverbal communication, you don't want to scrunch your face up and say, what is your that for?" But that's what you wanna do is you wanna approach it with some level of openness and curiosity and making sure that, right, they feel supported, and then you can also then introduce how it can be at times sycophantic, and it can be, much more people pleasing, and it doesn't really challenge you as an individual, but, trying to figure out, again, how they're using it and letting them know what some of the harms are.
Yeah. Yeah, I love that approach, especially, I think it should be now part of what we all do in terms of asking our clients, how do you use AI if you're using AI? Because I think it's good information for us to know, and you can use it therapeutically as well. One of the things that it also highlights to me, John, is that, we're not all trained. I think most of us are not well trained in terms of how to provide that education around AI and what it is and the things that they should be mindful of. How does this begin to impact how we train future psychologists, right? Because this is something that they will need to be able to do. How does this impact that, do you think?
Well, I think that supervision itself, as you know, is a competency unto its own. So it's not doing psychotherapy. So people who are doing supervision and doing it well, that they've received additional training,
Mm.
supervision, education in the process. Now, AI is only going to be an extension of that. So in many ways, just like the therapeutic relationship, the how well the therapeutic relationship is formed, you'll have better outcomes. And again, that's been known in psychotherapy for a long time. Well, you can look at people who've done research in supervision, like Watkins, for example, talks about the supervisory relationship and how that is the foundation, and that's the most important growth and opportunity for training for supervisees. So, making sure again that that relationship holds primacy. So you can't offload your supervision responsibilities onto an LLM. So what supervisors need to do is they need to understand what LLMs are. They have to develop some competency in terms of prompting. I don't know if we want to talk about prompt engineering or not, but that's the way you interact with AIs, so or LLMs. So that's what supervisors are going to have to be able to do is learn how to engage in prompt engineering for those kind of specific use cases. Are we using this for proofreading? Are we using this for case conceptualization? Are we using this for treatment planning? Are we using this for ethical decision making? Whatever the use case is, the supervisor then needs to be competent in the prompting that goes on, and then to demonstrate that kind of as a think aloud method that, because again, this is an iterative process too. And don't, supervisors don't hide in the corner and say, let me do this first and I'll bring you back this polished, fluent, result. But to be in there with the trainee or the supervisee, and then to go over and show the iterative process that needs to go on with prompt engineering.
Yeah, I think this makes a lot of sense for the supervisor to be able to help provide that awareness and that understanding to their supervisees. What about current psychologists, right? How much technical understanding does a psychologist need to use an AI tool competently?
Well, again, I think that they need sufficient training and education, and we don't have any benchmark for what exactly that is. Is it 3 hours? Is it 6 hours? Is it 20 hours? And again, just as we cited that study before, even 20 hours of AI literacy doesn't necessarily help people understand all the ramifications. So I think what again, we just have to use our best judgment, and we ultimately, as psychologists, are going to be held accountable for what we're using it for. So I would suggest that people who are interested go to a couple of trainings and actually start using it, not with high risk activities, but kind of very low risk activities. Like for what I had suggested before, let's say, you want to increase your knowledge or get a refresher for a certain, CBTI or a certain kind of technique. Prompt the LLM to see what you can get from that. So that would be like a very low risk activity. You can practice prompting for treatment plans. Again, you can make fictitious patients and just try to prompt and see what is it that I need to put in my prompt to get a fairly decent, treatment plan and what that would look like. So I would suggest psychologists actually start with these kind of low risk activities. And I think the higher risk activities, and again, I do know some psychologists who are already using these AI scribes and they don't understand because I've asked them, I said, well, is it used for training? Well, I don't know. Well, how long is it stored for? I don't know. And I'm not saying that to make fun of them. I'm saying that that is what our responsibility is. We need to know all of these things to make sure that we're using them competently. And again, with the idea of informed consent, if you're using an AI scribe, you need to be able to communicate that to your patient and explaining what that means, in terms of what the therapeutic relationship is. Now, again, you had mentioned before that these hospital systems are probably already using AI scribes, and psychologists aren't going to have a choice. They're going to have some choice based on what their patient says, though. So the patient comes in, says, "Here's my informed consent sheet. I want to use an AI scribe." Blah blah blah. You go through an informed consent process, and then if the patient says no, well, right, well then we can't use it.
Yeah. So that still gives them that measure of control. I'm thinking about kind of what you were talking about in terms of um, the standards that psychologists need to follow. And right now there isn't a clear standard across the board in terms of AI competency and guidance. But we do have our ethical standards, and I know you're an expert in ethics. What do we currently have in terms of ethical standards that still serve psychologists well in this AI world? And where is there still some ambiguity and some clarity that's needed, do you think?
Well, I think that we're still at a point. Well, let me try to answer the first part of the question. So, right, we do have the ethics code. We actually do have some guidance from APA about using AI technologies in our practices. So I don't have that reference handy, but they do have about, I guess it's about 3 or 4 pages that goes into some ideas that we need to think about. They also have a checklist. So before you use any AI technology, APA has a checklist for people to kind of go through to see if it's meets what would be the minimum standards, I guess is what you would call that. So we do have some guidance, but then we also have these rules that were developed even before AI technology. So we still have HIPAA, we still have high tech, and for the school psychologists out there or the trainers, we have FERPA. So we have these kind of older rules that we still need to follow. We have some guidance. So what I would suggest for people is to really take kind of a principle-based approach to ethical decision making. So the idea about autonomy, beneficence, non-maleficence, fidelity, and justice, and then you're weighing those principles. So if the code, if FERPA, et cetera, doesn't have the answer for you, then it's going to be up to the psychologist to go through kind of a structured way of making that ethical decision as to whatever the dilemma is.
Yeah, I think that makes a lot of sense using what we currently have in terms of the ethical principles. And as you're right, there's more and more guidance coming out, right? So I think that does make sense, especially from the APA and other organizations. John, this has been such an interesting conversation. I really appreciate your insights. How do people contact you if they want to continue the conversation or reach out for support?
Sure, I'm on LinkedIn. I'm also, you can always hit me up on my email at johngavazzi@gmail.com. And the site that I talked about earlier, where you can go, it's all free, but you can find lots of articles on ethics, AI technologies. I'm also a curator of some of the suicide research. So it's ethicalpsychology.com and you can go, I'm sorry, ethicsinpsychology.com, and you can go there. I already have over 15 million page views, so I'm not begging for page views, but it is a good educational source. I have an international audience, and I do know universities and large group practices use the site.
Great. Thank you so much. I really appreciate those resources. So I always like to ask our experts before they leave, what's a tip or recommendation that you can leave us with?
Well, in terms of AI, I'm going to just repeat what I've said before, is that we do have to remain cognizant of making sure the sequence is done correctly. And again, we have to use our human expertise first, and then the LLM follows. That would be my best suggestion to produce high quality care.
Great. John, thank you so much. It's been such a pleasure having you on the show.
Thanks for having me.
Great. And if you've enjoyed the show, please subscribe and leave us a review. Feedback is a gift, and we love gifts. We hope you join us again next time.